Today we're going to talk about all different procedures, hair transplant procedures, and every option that you have. Hi, I'm Dr. Parsa Mohebi, a hair transplant surgeon based in Los Angeles and San Francisco. Today I'm going to talk to you about all type of hair transplants and what is it good for you and what you need to know about them. A standard FUE hair transplant is a procedure that we harvest hair individually into natural grouping of hair, we call them follicular units, from the donor area on the back and sides of the scalp. So these hairs are being removed one at a time and they're being placed on the balding area. A FUT or follicular unit transplant is usually applied to a strip hair transplant procedure. A strip hair transplant is when we remove a piece of the skin from the back and sides. So from the middle of the donor zone or permanent zone, we remove a piece of the skin, a long piece of the skin, usually 2 or up to 2.5, 3 centimeter, depends on the number of grafts that we want, and we close the two sides. That strip of the skin that's removed is cut into slivers that are being also cut down into the natural unit of hair, we call them follicular units, and those are being transplanted. The FUT is a little bit outdated compared to FUE method because it has to be with cutting and suturing and leaves a line of a scar in the back. Some people do not want to have that scar or any pain involved with FUT procedure. FUT has advantages. One most advantage of FUT is the number of grafts that we can give in one sitting. So in one sitting, people can get more than 3,000, sometimes even 4,000 grafts. That problem has been solved with FUE by doing 2 procedures in two days back to back. The other advantages of FUE, can you cut that and put it together? The other advantage of FUT is, unlike the regular FUE, it doesn't require to shave the back. So the shaving is just limited to the area of the strip that is removed, and on 2 sides, patients have long hair so they can cover it. A celebrity hair transplant is a FUE procedure that is involved with removing hair from the back, from the donor area and sides without shaving head. We don't shave the recipient area, we don't shave the donor area. People walk in and out with the same shape with no evidence of any shaving that shows the procedure. So it's more time consuming, it's more expensive, it's more for certain people who cannot afford to shave their head. Beard-to-scalp is a procedure that we remove beard hair individually with the FUE method under microscope, and we transplant them to the scalp, to the balding areas. Beard hair could be removed from the bottom areas of the chin and neck area. Those are the areas that people usually trim when even they grow their hair. So average people with average number of hair, they can easily remove 1,500, maybe 2,500 grafts from this bottom area. If people don't want to grow beard at all and they want to remove hair from the entire face, that number can easily go up to like 5,000 or 6,000 grafts that could cover a very big number of big area of the scalp. A repair hair transplant is when people are getting hair transplant or did get a hair transplant in past with older methods or even with new methods, but the artistic touch was missing. The hairline location is not right, it's either too high or too low, the frontal hairline looks pluggy, or there is any other aesthetic unpleasing look of the hairline that we can fix. Thankfully, with the new methods of hair transplant with FUE procedure, we can individually remove any hair that is placed in the wrong place or with the wrong angle and place them in the right angle and right place. And any unwanted hair could be removed too, and the areas that we don't have hair and we should, for example, bring the hairline lower or fill some areas, we can easily remove hair from other areas and bring it to the area that needs more hair. A skull revision hair transplant is a type of repair procedure usually for people who had any craniofacial scars because of trauma or surgery. that scar is visible. It could be close to hairline, it could be too big on the back and cannot be covered with styling hair. So in those cases, we have different options. We can remove the scar. We can sometimes put hair into the scar to minimize the contrast of a scar that does have no hair and surrounding area that has 100% hair. Or we can use other methods like SMP or scalp micropigmentation to improve the appearance of the scar. Hairline lowering procedure is when we bring the natural hairline that we feel could be lowered to make people look better to the natural or better looking place. It's being done in two different methods. One is surgical hairline lowering, when the surgeon removes a piece of the skin and a band of the skin and basically close it so that way the forehead becomes shorter and hairline comes closer to the forehead. That has its own disadvantages, like it leaves a teeny line in front that sometimes we still need to go back and put a hair transplant in front of it to make it look more natural. The disadvantage of lowering hairline surgically is because it's a surgical procedure and we have to cut a piece of the skin and put it together. We have inevitably a scar, and that scar could be visible. We have to sometimes go back and put more hair in front of it with a hair transplant procedure, so patients need two procedures instead of one. The other disadvantage is because we cut the line and bring it down together, it cannot be as refined and as perfectly irregular as a natural hairline. It looks very straightforward and like very, you can connect the dots. So again, we can do another hair transplant, but the problem is patient needs two procedures instead of one. The other type of doing hairline lowering is by doing hair transplant into the areas that we want the hairline to come down to. Today, with advances in hair transplant procedure, this procedure is becoming so easy that there is not much need for surgical advancement of forehead. The advantage of it is that we can make it perfectly natural. We can create that natural irregularity of the hairline. The disadvantage is the result will be seen many months after the procedure. Unlike the surgical hairline lowering, the result could be seen immediately. This one patient has to wait a few months until the hair starts growing back. Transgender hair transplant is used to change a hairline, usually from male to female hairline or hair type. One of the characteristics of a feminine face is the hairline. When we look at the male face, we see the corners of the hairline is going higher compared to when people are kids, and the corners go way higher. This is called a mature hairline. It's not necessarily balding, it's just maturation of hairline. It's very common. All Caucasians after a certain age, they should have it. But when we see it in a woman, it doesn't look right. It feels like, okay, this is a masculine face. A lot of women lose it and they can get a feminization process so we can bring that hairline lower. But the most important thing is when a man is going through the transgender or sex reassignment procedures, that becomes probably number one procedure they have to do, because no matter what else you do in your body, as long as your face, the center of attention, look like a masculine face, you cannot be feminine. You can style it with hair, special hair styling, or wearing bangs and stuff like that, but that doesn't replace your natural hairline because that limits your styling. This procedure, we can easily bring the hairline lower, make the curve, natural curve, make those little touches that a feminine hairline should have to make it as attractive of a natural feminine hairline. Eyelash hair transplant is when we restore eyelash hair if there's any scar or if there's lack of hair. We remove hair from another place, usually scalp, and put them in the eyelash area. It doesn't require that many grafts, but it's technically more challenging than regular hair transplant. So it's done under local anesthesia, and the scalp hair that is transplanted keeps growing. So people who get eyelash hair transplant, unlike the natural eyelash that doesn't need any trimming, they have to trim it. But the advantage of it is that it can grow just like a scalp hair. So people, as long as they're comfortable with shaping and grooming their eyebrows, eyelashes, they can let it grow longer and have more options to play with. I hope I was able to answer all your questions about different types of hair transplant. If you have any other questions or comments, put them in the comment section below, and make sure you follow us on social media.